And now let's bring in our health correspondent, Uche Ogochukwu, who has been monitoring the alarming trend of meningitis in Nigeria. Uche, what exactly is the situation and what accounts for some of the deaths we have experienced this year alone?
Thank you, Jide. Already in Nigeria, reports have shown that we have 151 deaths, 74 in 2024 alone. Of course, we have them in 23 out of the 36 states affected already in Nigeria, and the northern states are predominantly affected. And in the course of the presentation, of course, we'll get to know all you need to know about this outbreak and the causes, and of course the causes, and of course the preventive measures, the action plan already in place. So now I'm talking about, we know research has already shown that meningitis is a bacterial infection, and seasons like known as the meningitis belt, which is between May and October, are always the majorly hit periods in Nigeria. We also have low vaccination rates and delayed healthcare access as some of the causes of this disease in the country. And we have symptoms like high fever, stiff neck, severe headache, primarily as the major symptoms. And we also have things like vomiting, sensitivity to light, and confusion as the secondary symptoms. And of course, we have the spread, just as I told you earlier. We have the northern states like Jigawa, Katsina, Sokoto are the hardest hit because, of course, we know they are majorly hot areas, hot parts of the country. And talking about the 36 states affected, the remote areas are having the highest burden of this, thereby straining the already strained health systems they have. And data has already shown us that high fatality rates are linked to late medical care. 24 hours window, it's very important in the decision between life and death as long as meningitis is concerned. So access to quick medical care matters a lot. We also have the U.S. aid. That is talking about challenges. We have the U.S. aid cuts, of course, affecting the preventive and control measures we already have. But the country, Nigeria, has its own measures already in place. There are actions already. We have 1 million plus doses of vaccine deployed via the Gavi Alliance. We have public campaigns for all these symptoms recognition and care-seeking behavior. That's to make the people imbibe the habit of seeking for health care early enough. And some of the long-term solutions advocated are mass vaccination drives and improved surveillance. We also have advocacy to address healthcare access gaps in remote areas. We know that these are the underserved population and they are mostly hit. We also have funding gaps and infrastructure improvement. These are advocacies that once they are improved, of course, Nigeria will get better. The effects of prevention and control will be seen more when all these action plans are in place. Thank you, Jide.